Vitamins. The first vitamin that we're going to take a look at is thiamine, or B1. It's a water-soluble vitamin. It's needed as a cofactor for the energy transformation reaction. So it's not directly involved in the production of ATP. However, it needs to be present for certain locations to have as a cofactor. It's also involved in the synthesis of pentoses for RNA and also a part of the synthesis of NADPH, which is a very similar compound to NADH and FADH that we find produced in the citric acid cycle for ATP production. Food sources: pork, beans, enriched breads and cereals, watermelon, acorn, squash. Those are all sources. Of course, there are many others. The claim here is that we can enhance our endurance performance primarily by lowering blood lactate levels and decreasing heart rate, which would enable an individual to perform a given task for a longer period of time and thus improve performance. The evidence and efficacy for this: if carbohydrate is sufficient in these athletes, then there's really no compelling evidence to utilize additional amounts of thiamine and get enhanced performance out of it. Side effects of vitamin B1 rarely seen, even at 500 times the dietary recommended intake. So that's quite a bit of thiamine that you can consume without actually experiencing any side effects. The application of this is about 900 milligrams per day. Riboflavin, or B2, another water-soluble vitamin. Again, it's needed as a cofactor for energy transformation to make that ATP. It's going to exist as FAD and FMN. These are needed for electron transfers, so you cannot produce FAD or FMN without vitamin B2. Source of B2 is going to be milk products, enriched breads and cereals, eggs. The claim here again is that we're going to enhance performance. The evidence and efficacy of this: if the diet is sufficient, it doesn't seem to be any compelling evidence to suggest that consuming copious amounts of vitamin B2 is going to enhance your performance. Side effects of this: none reported. Application: none was provided. Vitamin B3, or niacin. It is a water-soluble vitamin. Again, it's needed for energy transformation reactions. It exists as nicotinic acid and niacinamide. It's also a precursor for nucleotides. B3 is found in meats, poultry, fish, enriched breads and cereals, peanut butter, milk, eggs. The claim here is that it's going to, in bodybuilders, bring out the vascularity for them so that they look more veiny. Also, it has been used as an anti-hypercholesterolemic agent at about 3 grams per day. So you can give it in pharmacological doses to actually lower cholesterol levels in the bloodstream. The evidence and efficacy for this is actually some evidence to support both of these claims. The side effects here of niacin 3, you get the niacin flush or flushing, which basically is blood vessels coming to the surface of the skin, particularly in the face. Itching, potential liver damage as well. The application of this, none was reported. Okay, peroxidine, or vitamin B6. This is a water-soluble vitamin as well. It's needed for protein metabolism to do transamination, that is, moving the amine group from one amino acid to the carbon skeleton to make another amino acid. It exists as a pyridoxal phosphate and a pyridoxamine phosphate. The sources of this: meat, poultry, fish, fortified cereals, potatoes, some fruits like bananas and watermelon, broccoli, and spinach. The claim here is that you can increase muscle mass because of the involvement of peroxidine in protein metabolism. The evidence and efficacy: there's some evidence in support as an ergogenic aid in this regard. However, caution is warranted because the area of research really needs to be looked at a little bit more closely in order to come up with some more conclusive findings. As far as side effects go: unsteady gait, numbness of the hands, feet, impaired tendon reflexes, paresthesia, which is the pins and needles sensation that you can get for no apparent reason, possible degeneration of the dorsal root ganglia in the spinal cord, loss of myelination, so that myelin sheath that covers nerves, possible degeneration of sensory fibers in the periphery. It's important to note that a lot of these side effects are actually irreversible. So B6 can do some serious damage despite being a water-soluble vitamin. Most water-soluble vitamins can easily be excreted when you consume them in excess through the urine, but B6 can actually be toxic at high levels. So the application here is about less than 100 milligrams per day. Cobalamin, or vitamin B12, again another water-soluble vitamin. We need it as a coenzyme to take homocysteine and convert that into methionine. It's needed for reactions involving mutases in the mitochondria. Sources of this, animal foods only. So if you have a vegetarian athlete, they really want to be careful with how are they going to get their cobalamin sources, and more than often than not, they're going to have to supplement their diet with a B12 supplement. Fortified foods like cereals are a great source as well. The claim here is that you can have B12 be an appetite stimulant, so you can eat more and gain muscle mass. The claim is also that you have steroid-like properties. Efficacy and evidence for this, currently it's not really substantiated. It's mostly anecdotal, so more research is warranted. Side effects of B12, none reported. The application, since there are very few studies looking at this, there doesn't seem to be a cohesive application of this product. Pantothenic acid, or vitamin B5, another water-soluble vitamin. It's needed for the energy transformation reactions, again, as part of a cofactor. In this instance, coenzyme A. That is the part of the complex that forms acetyl-CoA when you're entering the citric acid cycle. So it's needed to make this complex, otherwise you can't run the TCA cycle appropriately. The source of this is widely available in a variety of foods. It's very easy to get B5 in the diet. As you can see, there's quite a breadth in as far as where we find B5. For food sources. The claim here is enhanced cellular replication, so increasing the muscle's ability to undergo protein synthesis so that you can make more sarcomeres and add more muscle fiber. The evidence and efficacy for this, there's some one study in particular that showed decreases in blood lactate, so that would mean that you could tolerate endurance exercise for a little bit longer. But however, again, more research is warranted, particularly for the claims of increased muscle protein synthesis. The side effects here, none are reported in the application, again, because there isn't much work out there. There's no cohesive application of this product as well. Biotin, also known as vitamin H, another water-soluble vitamin, again, needed for energy transformation reactions. It's going to be a cofactor there. So in this particular instance, it's functioning as a coenzyme. Sources of vitamin H, widely distributed in foods. Again, across the spectrum here, just like pantothenic acid, liver, soybeans, egg yolks, cereal, legumes, and nuts. One interesting thing about biotin is that it's actually produced and synthesized by the microflora, or the resident bacteria, in the large intestine. So if you have a healthy gastrointestinal tract, the resident bacteria that are colonizing our large intestines can actually produce this vitamin, which is a good thing. So if you're not consuming large amounts of it in the diet, then we actually manufacture it. The claim here is that we're going to get enhanced energy production, so we'll be able to increase the amount of ATP that we produce. Evidence and efficacy for this, we still need some studies to tease this out. As far as side effects, none reported, and the practical application, there's nothing reported there as well. Okay, folic acid, or folate. This is another water-soluble vitamin. It's needed for amino acid metabolism. It exists as tetrahydrofolate. It's essential for cellular division, purine, and pyrimidine synthesis. So it's involved in DNA metabolism. So we have to have folic acid in our diets. Sources of this, green leafy vegetables, legumes, orange juice, fortified breads, and cereals. The claim here is that we can actually enhance exercise performance. Evidence and efficacy for this. We can increase blood folate levels, but it doesn't seem that it's going to increase exercise performance. So we definitely need more research in this area. As far as the side effects, generally nothing reported here, but some individuals are seeing toxicity at more than 15 milligrams per day. Insomnia, malaise, irritability, diminished zinc status because it can interfere with the absorption of zinc, and some gastrointestinal problems have also been reported. The application of this, again, no practical application has been found. Okay. Vitamin C, or ascorbic acid, another water-soluble vitamin here. We need it for the production of collagen. Collagen is a very important protein that is used as the building blocks to construct things. So, for example, blood vessels are going to have collagen as a foundation. Bone's going to have a foundation of collagen to deposit mineral on. It also functions as an antioxidant. Sources of this: citrus fruits, bell peppers, kiwi fruit, strawberries, broccoli, potatoes, tomatoes. The claim here is that strenuous exercise is going to increase the need for vitamin C, and that we might actually get better heat tolerance. Evidence and efficacy for this: we know that after exercise we actually have reduced tissue levels of vitamin C. We know from the literature that there is some improvement in heat tolerance. We can reduce serum cortisol levels, which is related to the amount of overall stress that we're experiencing, and we know that it functions as an antioxidant, that it protects us against free radical production. In fact, the research looking at this has looked at a lot of elite athletes who are really susceptible to URTI, or upper respiratory tract infections, and when you have these athletes consume a little bit more vitamin C, they actually reduce their development or risk of URTI, or upper respiratory tract infections. Side effects of this: greater than 3 grams per day, which is a huge amount. You're going to see diarrhea, kidney stones. You might actually get an excess amount of iron uptake, because vitamin C actually donates an electron to convert iron and donate an electron there so that you can increase the absorptibility of iron. And so people who have a genetic condition called hemochromatosis, that actually puts them at risk for liver damage and liver failure. So we want to be careful in those individuals with vitamin C at this kind of intake. It does give you a false negative fecal occult test, and it also can invalidate a urinalysis for testing for glucose in urine. Glucose is not supposed to be in urine, but during this test, if you have too much vitamin C, and there's a possible interference there with that test. The application of this is about 500 milligrams per day. Okay, the vitamin E slide here is the first of 4 fat-soluble vitamins that we have. So as opposed to water-soluble vitamins, which dissolve in water and can, in general, be readily excreted via urine, the fat-soluble vitamins cannot be transported in the bloodstream without having some sort of transport protein. Usually things like albumin in the blood will carry these. The lipoproteins will carry the fat-soluble vitamins. So for vitamin E, you'll find them in quite a number of forms, and they're usually lumped into the tocols or the tocotrienols. We need vitamin E to maintain the integrity and stability of cellular membrane. So that phospholipid bilayer is an important area where you'll find vitamin E protecting that plasma membrane against free radical production. So it's an antioxidant. So sources of vitamin E: plant foods, vegetable oil, salad dressings made with oil, nuts, seeds, leafy green vegetables, whole grains, fortified cereals. The claim here is that we're going to decrease the susceptibility of LDL, which is a carrier of cholesterol and triglyceride and some protein, to oxidation, which means if we can reduce the amount of LDL that's being oxidized, we actually are going to lower our risk for atherosclerosis. So we'll lower our risk for dying of a myocardial infarction or experiencing a myocardial infarction. The evidence and efficacy of this: there's a good body of evidence as an anti-atherosclerotic agent as well as an anti-carcinogenic substance. So we can lower our risk for cardiovascular disease as well as cancer. It is well studied. Side effects of this, greater than 800 milligrams per day, are going to give you diarrhea, flatulence, nausea, muscle weakness, and fatigue. Greater than 1,000 international units can also act as a weak blood thinner, so you want to be careful if anybody is on a blood thinner with vitamin E supplementation. Application of this is about 400 to 1,000 international units per day. The next fat-soluble vitamin is vitamin D, or 1,25-dihydroxy-D, which is a important regulator of quite a number of things, but in particular, calcium balance. So we want to maintain calcium levels in the blood very, very tightly, and vitamin D is an important player in doing that. You should also note that vitamin D is a very, very hot topic now in the literature. There are a whole slew of research areas looking at anything from exercise performance to cancer to Parkinson's, and trying to associate vitamin D status in the blood and how much vitamin D is concentrated in the blood with all these different diseases. And it seems like individually there may be something there, but as a whole, we're not quite sure where we're headed with vitamin D. So be on the lookout for a lot of literature in the near future that is going to discuss vitamin D and possible links with a variety of diseases. So sources of this, it's hard to get vitamin D in the diet. You've got to consume fatty fish, fortified foods like milk and orange juice and cereals, butter, margarine, yogurt. It is produced by human skin when you expose human skin to sunlight, the UV rays that cause damage to the skin, that or put us at risk for increased skin cancer rates. That's the actual light that we need to actually produce vitamin D. So it's a delicate balance between getting out in the sun and getting enough exposure to sunlight in order to produce vitamin D if your diet's not rich, but on the other hand, too much sunlight is going to increase your risk for skin cancer. The claim here is that we're going to prevent osteoporosis and prevent what's called the female athlete triad, which ends up with the female having a low bone mineral density, which of course sets these young ladies up for osteoporosis later on in life. The evidence and efficacy for this are very, very strong. It's well studied. The female athlete triad is a well-known problem in women athletics, and it's something that we need to be on the lookout for and try and advise our athletes so that they don't predispose themselves to osteoporosis later on in life. Side effects here, anorexia. Now, what do we mean by that? Anorexia just simply means that you have a lack of appetite. So by consuming vitamin D, we have a lack of appetite. The psychological condition where we have an eating disorder, that's called anorexia nervosa. So that's different from just anorexia. Anorexia is just, all that means is a lack of appetite. Nausea, renal insufficiency, failure to thrive in infants and children, hypercalcemia, so you have high blood levels of calcium, and possible calcification of soft tissues. Application of this, multivitamin with athletes perhaps, and if it's physician directed, then vitamin D supplements along with calcium supplements. Vitamin K is another fat-soluble vitamin. It's needed for post-translational carboxylation of glutamic acid residues to form gamma-carboxyglutamate. This is all necessary for normal blood clotting. Sources of this: raw spinach, turnip greens, romaine lettuce, cabbage and cauliflower, cooked broccoli, okra, asparagus, chicken livers, blueberries, and blackberries. The claim for this is that we get increased exercise performance. The evidence and efficacy, there hasn't been anything reported, so vitamin K doesn't appear to be an ergogenic aid. Side effect of this, only with the synthetic metadione are you going to see toxicity. So we want to be careful there. That can lead to hemolytic anemia, where red blood cells basically burst and fall apart, and that means you're going to lose iron, which means then you can't carry oxygen accordingly. Hyperbilirubinemia, so high levels of bilirubin in the blood, which then could, of course, lead to jaundice. The application of this, a multivitamin at the most. Make sure that you are consulting with your physician in order for approval of individual supplementation. Okay, vitamin A, another fat-soluble vitamin. It exists as retinol, retinal, and retinoic acid. It is a fat-soluble vitamin. It's needed for vision, for cellular differentiation, so to give cells a specific job and what they're going to become. You need it for growth, you need it for reproduction, bone development, and the immune system. Sources of this: milk, milk products, eggs, fortified foods like margarines and cereals, deep orange fruits, vegetables, dark leafy greens. The claim here is that you get an improvement in antioxidant status and that you'll ameliorate markers of oxidative stress induced by exercise. So it's functioning as an antioxidant, basically. Evidence and efficacy for this, mixed results currently. So we definitely need to explore the use of vitamin A in athletes a little bit more. Side effects of this: if you have a female that's pregnant, there are known teratogenic effects in the fetus. So the fetus is going to have improper development and end up with some side effects because of consumption of vitamin A. So we do need to be careful with this. Anorexia, so again, that's lack of appetite. Dry, itchy, flaky skin, alopecia, so hair loss, headaches, bone and muscle pain, conjunctivitis. These are all side effects that have been reported. Thankfully, these are easily reversible, except for the teratogenesis. So that's the only one that's not reversible here. Application of this, a multivitamin source is what's recommended.